Well, sleep disorders is something where you either sleep too much or you don't sleep at night, or you have abnormal sleep pattern, abnormal sleep behavior, which we call REM behavior or non-REM behavior disorder, like night terror, sleepwalking, sleep talking, and sometimes even aggressive behavior during sleep. So all these form a part of abnormal sleep behavior. Also, the sleep-wake cycle abnormalities, like we see these days in the BPO industry, or those people who are on frequent night shifts. Then you have jet lag problems with too much of traveling around the world and crossing the time zones. That is what leads to jet lag. So all these form sleep disorders, which now is a specialty in itself in the Western world, as well as in Australia, New Zealand. But in India also, we are trying to promote it in as big a way as possible, so that people are more aware. The doctors, the physician community is more aware about sleep disorders. So there is a full specialty with certification courses, with postgraduate and postdoctoral courses in the US. Well, snoring is nuisance to others, but type of snoring which is heavy or moderately heavy, and especially if it is interrupted with pauses, is dangerous. Dangerous means it is suggestive of sleep apnea, obstructive sleep apnea, which can be dangerous. Now, people don't realize this. People think snoring is like a lifestyle thing, and somebody who is snoring heavily means that he is sleeping nicely. That is not necessarily true. More often, it can be a harbinger of a more sinister problem that might be brewing up in the body. Well, sleep apnea is a condition where there is a collapsibility of the upper airway. Upper airway means the place in the throat that you can actually see if you open your mouth and look up in the mirror. There is a tonsillar area, then there is a soft palate. If you go back with your finger, you'll feel the hard palate first, and if you go backwards, you'll feel a very soft area. It's called soft palate. And in the middle of that is an overhanging tissue, which is called uvula. Now, if you have a very biggish overhanging soft palate and largest uvula, it would actually sit over the back of the tongue. If somebody has thick tongue, or somebody has a retracted jaw, or sometimes people have a smaller jaw, or big tonsils, then the whole area becomes very narrow. People who are obese, particularly, they tend to have fat deposition there, which again narrows down the area. So there is a critical pressure which actually determines whether this passage is going to remain open during inspiration and expiration when the patient is sleeping. But if the critical pressure is crossed, then the whole area would just collapse. Patient is trying to breathe but he can't take the air in, making an effort. Thoracic and abdominal excursion is there, but there is no flow of air. At some point, the brain gets aroused. The moment the brain gets aroused, the muscle tone comes back. There is a sudden gush of air going in, and the patient may produce a sound like this. When you observe a patient who is sleeping and snoring, if between snores there is an interruption, there is no sound coming, and it ends up with such a loud snort, you actually have made the diagnosis of sleep apnea. Such patients have such a huge number of brain arousals, sometimes 50 to 70, 100 times in an hour on an average, that the patients don't go into deeper phases of sleep. They go into superficial sleep, get aroused. Superficial sleep, get aroused. Stage 1, 2, they don't get a chance to go into stage 3 and stage 4 sleep.